Okay, so what happens in the lipid transport is that whenever you take a fat or cholesterol rich diet, the dietary fat and cholesterol is first broken up by the pancreatic lipase, just digests it and converts it into smaller particles, that is the micelles. The micelles then enters the small intestine, and it is basically taken up by the enterocytes in the intestine, and the enterocyte converts the micelles into chylomicrons. So the chylomicrons, they leave the enterocyte to enter the lymphatics which is surrounding the intestine, and with the help of ApoB48. It's written here, but it's actually how the chylomicrons enter the lymphatics. So once in the lymphatics, they travel through the thoracic duct and then they enter the circulation at the level of subclavian veins. The chylomicrons are released from the thoracic duct into the subclavian vein. Then they travel through the subclavian vein into the systemic circulation, and once the chylomicron is in the circulation, it is very rich in triglycerides. So whenever it passes near an adipocytes or adipose cells or muscle cells, these cells have lipoprotein lipase, and the lipoprotein lipase basically cleaves off or takes off free fatty acid from the chylomicron particle, and the chylomicron now becomes the chylomicron remnant. Basically it takes off the free fatty acid from the chylomicron and leaving a smaller chylomicron remnant. The chylomicron remnant is taken up by the liver, and the chylomicron remnant is converted by the liver into VLDL. And basically what happens is that the chylomicron, when it's taken up, the liver then converts it and basically makes the liver makes VLDL, and the VLDL is released from the liver with the help of ApoB100. So first lipoprotein that we talked about was ApoB48, and the second one is ApoB100. Once in the circulation, the VLDL is then traveling and then passing through the circulation, and then again, since it is very rich in cholesterol and triglycerides, the adipocyte, whenever it passes near the adipocytes again would like to have that free fatty acid. So adipocytes have the lipoprotein lipase that takes off the free fatty acid from the VLDL, and now the VLDL becomes the IDL once the free fatty acid has been taken off. The IDL has then travels through the circulation. It has mainly two primary pathways that it can either go through. First is that it can be reabsorbed by the liver, or it can just be reabsorbed by the liver. Or the second one is that the IDL is converted by hepatic lipase into LDL. So IDL is converted by hepatic lipase into LDL, and LDL is what is called the bad cholesterol. It's called the bad cholesterol because because when it is oxidized, it can form atheromas. So LDL is very rich in cholesterol. It has very little free fatty acid. All of the free fatty acid has already been removed through the whole pathway. So it is like very rich in cholesterol right now. So what happens with the LDL is that LDL can either go into the liver, and LDL can be reabsorbed back into the liver if the liver needs more cholesterol, or the LDL, what happens mainly is that the peripheral cells have LDL receptor, and the LDL is then taken up by the through the LDL receptor, and this is called as LDL receptor mediated endocytosis. So this is how the whole lipid transport mechanism works.